Most men believe that whatever fades with age is gone forever. They assume that once strength, responsiveness, or confidence begins to change, there is no way back. That belief settles quietly into the mind and becomes accepted as truth. But the reality is very different. What many men experience is not permanent loss. It is something that has simply been ignored for years. Gentlemen, let me ask you something honestly. What if there were a single spot on your body, no larger than a coin, that when gently touched and massaged for just 1 minute a day could help support blood flow, improve sensitivity, and assist the body in restoring functions that may have faded over time? For many men, even hearing that idea may feel uncomfortable or difficult to consider. It may sound unrealistic or even strange. But stay with me, because what you're about to learn is grounded in how the body actually works. In the next few minutes, you will learn where this area is located, why it matters, and how a simple, calm daily habit can support the body in a way it has been waiting for. This is not about forcing anything. It is about understanding the body and responding to it properly. Before we continue, take a moment to support the channel. If staying healthy, confident, and steady as you grow older matters to you, tap the like button. Leave a comment telling me where you are watching from. It is always encouraging to see men from different places supporting one another. And subscribe so you do not miss future videos focused on men's health, vitality, and confidence. Now let's talk about what this hidden area actually represents and why it has been overlooked for so long. Many men believe that changes in performance after a certain age are unavoidable. They assume that circulation naturally slows, hormones decline, and intimacy becomes more difficult. Because of this belief, they either ignore the changes or rely on quick solutions that only offer temporary effects. These approaches rarely address the real issue. Age itself is not the main problem. The real issue is tension and reduced circulation in the pelvic region. Years of sitting, long periods of stress, shallow breathing, and reduced movement cause the muscles in this area to become tight and unresponsive. These muscles play a role in blood flow, control, and sensation. When they remain tense for long periods, communication between nerves and blood vessels becomes impaired. Imagine an old rubber band that has been stretched and left unused for years. It becomes stiff, less flexible, and loses its ability to snap back. This is similar to what happens in the body. When tissues remain tense, blood vessels do not expand easily. Nerves send weaker signals. Responses that once felt automatic and reliable begin to feel inconsistent. The encouraging truth is that the body remains adaptable, even later in life. When tension is gently released and circulation is encouraged, communication between the brain, nerves, and blood vessels can improve. This understanding is not new. Traditional systems recognized the importance of this area centuries ago. What has changed is that modern physiology now explains why attention to this area can be helpful. One of the most overlooked contributors to male performance changes is chronic pelvic tension. Stress, long hours of sitting, and unconscious clenching throughout the day cause the muscles in this region to remain tight. When this happens, circulation slows and sensitivity decreases. Gentle touch and pressure help relax this tension, much like slowly loosening a knot that has restricted movement for years. Another common mistake many men make is relying only on medication. While medication can create temporary changes, it does not address flexibility, circulation, or nerve responsiveness. This is why results often feel inconsistent. Techniques that work with the body rather than forcing it tend to support more stable outcomes. The biggest misunderstanding of all is believing that aging automatically means decline. Many men well into later decades of life are surprised to discover how responsive their bodies still are once circulation and relaxation are supported. The body does not forget how to function. It responds when it receives the right signals. This approach is not about chasing performance or forcing results. It is about restoring awareness, easing long-held tension, and allowing the body to do what it was designed to do naturally. If you continue watching, you will learn how to approach this safely and calmly, without pressure, embarrassment, or unrealistic promises. Vitality does not disappear with age. It simply waits for the right signal. Within weeks, many men notice something unexpected returning. Not only physical responsiveness, but also confidence and a sense of closeness. These changes often feel subtle at first, then gradually become more noticeable as the body adapts. Now let's move into the practical part. This technique is simple and should never feel forced. The area you are looking for is located between the scrotum and the anus, centered in the soft tissue between them. This area may feel slightly different from the surrounding tissue. Mild tenderness is normal and often indicates that you are in the correct place. Before beginning, get comfortable. You may sit on the edge of a chair or lie on your back with your knees bent. The goal is comfort and ease. There should be no strain or tension. Using your index and middle fingers, apply gentle pressure. The pressure should be similar to checking the ripeness of a tomato. Firm enough to feel contact, but never painful. Massage the area gently for about 1 minute. Small circular movements work well, as does a gentle press and release motion. Move slowly and keep your breathing relaxed. This is not about speed or intensity. Awareness matters more than force. Using a natural oil can make the experience more comfortable. Oils traditionally used for tissue support include castor oil, coconut oil, or black seed oil. Warming the oil between your hands before applying it helps the body relax. This should be done once per day. Morning sessions may support circulation, while evening sessions can help promote relaxation and overnight recovery. What matters most is consistency. 1 minute each day is far more effective than long sessions done occasionally. Some men feel hesitant at first. That hesitation is understandable. Many men have never paid attention to this part of their body. But this practice is not strange, and it is not something to feel embarrassed about. It is about restoring comfort, function, and dignity. One man in his early 60s shared that after several weeks of consistent practice, he noticed more than improved responsiveness. His lower back felt looser. Hip discomfort decreased. Even bladder control improved. Most importantly, he said he felt more like himself again. That is the true goal here. Quality of life. Not chasing results. Not forcing change. Simply giving the body what it needs to respond naturally. Remember this. 1 minute a day. Gentle pressure. Consistent attention. Small actions practiced daily can support changes that quick fixes never address. If this message gave you hope, tap the like button so more men can find it. Subscribe if you want calm, practical guidance focused on long-term health. And in the comments, share one small change you are committed to making this week. You are not broken. You are not too old. Your body still responds when you listen to it. Take one small step today.